Okay, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment here. We know you've got a meniscal tear. There it is right there. And that tear is in a place that is just really begging for a fast fix, so that's what we'll do. It's a type of meniscal repair. We sure don't want to take away the meniscus if we can avoid it. And that looks like just a single stitch ought to give us a chance anyway to get that to recover and heal. The rest of the inside or medial compartment of this knee looks pretty good. You can see there's a little bit of a chondral injury here. Okay, and now we're going to look in the central part of the knee. This is the torn ACL. We can see all the way back here. See how there's no anterior cruciate ligament here at all. So even though it may look like there's fibers here, there's really nothing there. So we're going to take this part away so we can place the graft in the correct position here. We'll go off on the video for a little bit. Okay, now we're looking in this lateral compartment. And unfortunately, we're seeing more damage than we saw in the MRI scan from, I guess, about 6 months ago. Because you now have a significant tear in this lateral meniscus. So, yeah, no, push down on the knee and lift the ankle up. So we're going to identify this tear and look at it and see what we can do on this side of the knee also. Okay, so this is the lateral meniscus. As we look underneath, you can see the tear here. Okay, we've got one, or the posterior extent starts here, and I was going to say about an inch, maybe an inch and a half, 1.5 inches of tear. And this is obviously going all the way to the popliteal hiatus, so in terms of technically repairing that, that makes it a little bit trickier. We'll show you some more in just a minute. Okay, so that's the stitch right in the middle of that tear on the lateral meniscus, and hopefully that's going to save that for us. I really don't want to do anything more to that because it looks pretty good. I don't see any significant cartilage problems above or below on the plateau or on the femoral condyle. And now we're going to work back and look in the medial side because we still haven't fixed the medial meniscus. But as we start to bring the knee out, you can see how that meniscus on the lateral side is going to look. That looks good. Okay, we're back on the medial side now. Here's that little small chondral area that we debrided a little bit, and then here's the tear. And so we're going to get to work on that in just a minute. Okay, so we've placed 3 vertical sutures to take care of that tear. You can see them there, 1, 2, 3. Okay, and now we just have to give that time to heal. So we've really done quite a bit more than we were planning to do, but we were ready for it. And just had to repair both menisci. We're going to take a look up in the patellofemoral joint. We've already cleared out some space to put in the new graft, but before we get to work on that, we're going to look in the patellofemoral joint. Okay, so I want to show you, we're starting to make tunnels in the bone to place the graft. We've drilled the femoral tunnel, which is what we're looking at now, up to a depth of 35. You can see there's the 40 mark. That's 35. You can see 30, so obviously 35 is the line in between. We want to go to 35 to make sure that we have room to place plenty of graft in that tunnel. And then we back it out like that. And now we're going to take a smaller drill called the endo button drill to go all the way across there. Yep, that's important. Don't let go of that. Okay, just want to show you how we measure the tunnel. Hold this again. So we're 40. The measurement of 40 is the black line right above it. So we're really at about a 38. And so now we'll make the rest of the measurements. We'll go off on the video for a little bit because we're going to have to prepare the graft. We'll show you when we're pulling the graft into position. Okay, so here's the ACL graft in position. It looks really good. We're just about done here. I just wanted to make sure the screw was in a good place. We used a 7x30 screw, and it's flush not only at the tibial cortex but also right inside the joint. So I'm really happy with the way that looks. There's good tension on the graft. We can even use our shaver as a probe, and you can see that that's got good tension on it. It's not loose. So you had a good posterior drawer. And now we're going to go ahead and close things up and get you back to the recovery room, okay? So good luck to you now. Bye-bye.